And we're live. Oh, okay. Hey guys, it's Dr. Emer. We are in our 10-day follow-up with one of our revision cases. My patient that had a previous surgery had some irregularities in indentation, some areas that had extra fat that he just didn't like, and really honestly needed skin removal. When he bent forward, there was a lot of hanging and indentations, but he said, you know what, Dr. Emer, I trust you to get the best results without doing the tummy tuck. Let's see what we can get. And so I'm going to show you guys really quickly. I want to see if I can pull up. I don't know if I have it on here. Do you guys remember the day of the surgery?
20th.
Okay, hold on. Let me take a look. Let's see if I can find. I'm going to pull up for you guys 1 second. Let's see if I have one without nudity. See, oh, this is, yeah, I can show them this when we cut this. Hold on 1 second. I'm going to show you guys really quickly. We're going to cut out the nudity here of what he looked like before. Perfect. Okay. So now let's open that up. So this was our before. Okay, I'm going to show you guys now. You can take a look. This was our before, and here we are now. So normally this line right here, you can't get rid of this with lipo alone. It doesn't matter how much you heat. Also, a lot of this looseness down here, really hard to get rid of. You could see also there was some sagging a little bit in the chest. So what we did was we went through, I gave him a little more lines here and a little more in the middle. And then this area here, which is literally, if you squeeze, it's all this hardness is gonna be tightening when the Renuvion J plasma settles. Right now, this is just scar tissue that's going to be massaged out. There's swelling that's here. You can see the yellowing. And you can see, though, how much slimmer he is on the sides of the chest, on the sides of his flank, much flatter here in the stomach. This indentation is now no longer there. And look, it's more even. You can actually see the ribs, which I wanted to see. And you can see much more definition that's starting to form. This tightening here is going to get a lot better, and he doesn't have that irregularity anymore in the stomach. Relax again and then squeeze again. See, that's the thing. You can see this hardness right here. That's perfect. That's all the internal heating. That's going to be improved, and it's looking great. So I want you to kind of like turn a little bit, just a little bit so people can see. Great. You can also see along the side, look, if I pinch, there's literally nothing here. This is rib, look, so little. This is all the Renuvion. And I pinch here, even here, look, I can't because it's so tight because of the internal heating. I'm gonna turn you back. And so that's what we're doing when we do revision cases. We try and get as much improvement as possible with what we're willing to do. And in this case, because we didn't do the tuck, this is probably the best outcome we'll be able to get, which, to be honest, is a great result. And for somebody who just wants to look better, doesn't need high def, doesn't need the six-pack, wants to really, honestly though, I will say, look, there's much more of a curve here now. He's got the definition here, and this irregularity, I'd feel comfortable taking my shirt off because it's gone. This line, which you normally is really hard to get rid of, in about 6 months, 3 months, you probably won't even see this. And you could start radiofrequency treatments now. He could start TruSculpt Flex or M-Sculpt to really start to tighten the area up a little bit more and give more of an improvement. What are they saying on there? Anything good?
Looks good. Perfect.
They're really happy. How do you feel about it?
I love it. Thank you, Dr. Emer. You're awesome.
That's great. No, he's happy. And you guys, this was the patient that was awake during surgery. And I used to do that for many years. When I started out as a dermatologist, we did all these surgeries awake. When you do the internal heating, it's very painful. He was able to push through it with flying colors, no problems, and got a great result. So we'll stay tuned over the next few months. You guys will be able to see his result. We'll turn him again just a little bit so you can see more contouring through here. You can see the V-taper coming in. He's much flatter through here. This tightening is great. I really don't see any irregularities at all that I'm worried about. Much more definition laterally that gives him more of an athletic sort of shaped look. And then we bring you forward again. And his chest is even improved by doing a little bit of the micro-lipo on the border. All right, take care, guys. Perfect.
Thank you so much.
Yeah, it's great. I'm super happy.
You're awesome.
All right, you did great. So just follow all the aftercare and you'll be set.